24-year-old guy looking for advice on best way to proceed with my baggy eyes. What can I do to remedy this situation? For the past years, I have increasing darkening and swelling bags under my eyes. I've always had insomnia. Because of my social life and my work schedule, it is also very difficult to get into a nightly routine. Lastly, I have had constant post-nasal drip every day for the past 2 years. If those of you familiar with this area find it is commonly associated with baggy eyes, that would be interesting. I would like to do what I can to remedy this situation. Thank you.
Thank you for your question. You're 24 years old and you've been wrestling with the issue with puffy eyes. And in your question, you described several issues that I'll discuss with you and how can be affecting the appearance of your eyes. You're talking about irregular sleep, insomnia, post-nasal drip, the type of work that you do. And so with the photos you submitted, what I can see, it appears to be puffiness under the eyes. And that puffiness, you would have to ask yourself if it's constant. Now, if it's constant, then this puffiness represents something called lower eyelid fat prolapse. Lower eyelid fat prolapse is when fat that's normally around the eyes pushes forward and creates a bulge, and that bulge makes the eyes look puffy. Now, the eye area happens to share a zone of drainage which is also associated with the sinuses. So if someone has issues such as sinus problems and allergies, then the puffiness can actually look more significant and can fluctuate. You can have good days, or if it's constant, you may have days where it looks even puffier than other days. Irregular sleep is a stress, and when people ask me about what they can do to help maintain the appearance of their eyes after they've had their cosmetic procedure, they want it to last a long time, I always remind them about what a typical American president looks like on the first day before the inauguration and what they look like 4 years later. Where do they always look like the job has affected them? In their eyes. Their eyes look very tired. The eyelids are the most sensitive thin skin in the body, and the tissue is very delicate. And so stresses on your body, whether it's physical, lack of sleep, sinus, allergies, can affect the eyes. Now, in terms of the fat prolapse, I can recommend that you consider a lower eyelid blepharoplasty, which is approaching and sculpting the fat pockets. In my practice, I prefer the transconjunctival approach, which is from behind the eyelid, to reduce the puffiness. At least that'll possibly take away enough of the negative of the appearance. But it is very important to try to work on your lifestyle and address the issues with the sinuses and allergies. In terms of lower eyelid transconjunctival blepharoplasty, we routinely perform this procedure under local anesthesia with minimal sedation or IV sedation so that our patients can recover quickly so it doesn't disrupt their work schedule too much. I think it's important for you to move forward with meeting with doctors, possibly allergists, ear, nose, throat doctors, as well as qualified, experienced cosmetic surgeons to get some opinions on what you can do to at least help you look less tired. So I wish you the best of luck. I hope that was helpful, and thank you for your question.